other thing we're all paying attention to is the Delta variant. And although I'd love to not be having to pay attention to the Delta variant, but I know that I often go to our tracker here at the Post, look at what's happening with cases, but also what's happening with hospitalizations and deaths. So we're obviously seeing cases go up largely because of this more transmissible variant. But do you expect to see hospitalizations and deaths increase as well? And I know that's something we may not know for a few weeks.
Well, it's a good question, Paige, and because we are seeing the cases primarily crop up in people who are unvaccinated, I am worried about hospitalizations and deaths. Here's the good news, though. We have done a really good job as a country at getting the vast majority of seniors vaccinated, and we know that seniors are the ones who are high at risk of death and hospitalization when it came to COVID-19. So I do think, unfortunately, we will see an increase in hospitalizations and deaths. We've already started to see that actually in a number of counties that have been hard hit, driven by the Delta variant over the last few weeks. But I don't think that it will be nearly as bad in terms of hospitalizations and deaths as what we saw in January. Now, of course, it was a terrible situation in January. We had hundreds of thousands of new infections a day. We were losing thousands and thousands of Americans each day. It was terrible. I don't think it'll be that bad, but that shouldn't be our bar of what's acceptable. In this moment, every person who gets COVID-19, in particular every death from COVID-19, is one that may have been preventable because we have a vaccine, several vaccines now, 3, that are highly effective, particularly in preventing hospitalizations and deaths. So I do think that unfortunately we're going to see this get worse before it gets better. But this is a moment where we need to not only look to what the government is going to do, but we need to ask ourselves, what can each of us do to help vaccinate and protect our loved ones and our community? So asking your family and friends if they've been vaccinated, if they haven't been, asking them if you can do anything to support them in that process. If they need help making an appointment, they can go to vaccines.gov. It's so easy now to get an appointment compared to how it was before, and you can even walk into many places, get vaccinated on your own schedule. But if they have questions about the vaccine, you can also find scientific evidence-based information at vaccines.gov. So however we do it, all of us have to step up and recognize that as individuals, as teachers, as employers, as people who have people in our lives who love and trust us, we can play an important role in helping people get vaccinated.